What do old track marks look like? Have you ever wondered what old track marks really look like? These marks are often associated with intravenous drug use and can tell a story about substance abuse. Let's break down their appearance and what they signify. Old track marks are visible signs on the skin that develop from repeated needle injections. Over time, these marks can change the skin's texture and color. They can appear as scars that are lighter or darker than the surrounding skin. Depending on a person's skin tone, these scars may be white, light pink, or even darker patches where injections occurred. You might notice that the skin over damaged veins can become indented or puckered. This happens due to the weakening of veins and the buildup of scar tissue. As a result, the area may look uneven or textured. Track marks often follow a linear path along the veins, especially on the inner arms. This means you might see a line of scars that runs parallel to the vein. In some cases, if multiple injections occur in the same area, you may see clusters of small scars instead. Another thing to look for is changes in the veins themselves. Under old track marks, veins may appear darker or more prominent. In heavy users, veins can collapse or harden, which can further change the skin's surface. Persistent discoloration is also common. Bruising or hyperpigmentation can linger long after the initial wounds heal, making the skin look darker or bruised. The inner elbows or the crook of the arm are the most common sites for these marks. This is because the veins are easily accessible and visible. However, other areas like forearms, lower arms, legs, neck, groin, and feet can also show signs of injection. Some individuals may switch sites to avoid pain or hide marks, leading to track marks in less visible areas. Old track marks may resemble small, puckered scars or circular marks where the needle punctured the skin. The skin in these areas can become fragile and more prone to infections if the damage is severe. Repeated injections can impair healing, causing scars to be thickened or irregular. Recognizing old track marks is important for identifying ongoing or past substance abuse. They serve as physical evidence of intravenous drug use and can indicate the severity and duration of addiction. Health professionals often assess these signs to evaluate the risk for infections, vein damage, and other complications related to intravenous drug use. Understanding what old track marks look like can help guide interventions and support for individuals struggling with addiction. It emphasizes the need for medical care, wound treatment, and addiction recovery services.